I'm Lynn Cole, and I'm in the Doctorate of Nursing Practice program. I've been working for the last almost 20 years in developmental and behavioral pediatrics as a pediatric nurse practitioner, currently the Associate Division Chief in Developmental and Behavioral Pediatrics. And I get to do a lot of planning new programs, writing grants, figuring out what the community needs, and putting that in place. So I work with physicians and psychologists and speech language pathologists and social workers, and many of my mentors in my role are not nurses. And so coming back and doing my DNP has allowed me to loop back around to what I feel like are my roots in nursing, and allowed me to have a team of mentors within the School of Nursing who also share a philosophical approach to patient care and to health and wellness that are really important to me. So I think nursing really helps me to have a good perspective on working with children and families who have experienced either early childhood trauma or who have experienced prenatal alcohol exposure. It helps me see the child as part of a broader family and to see some of the things that they're dealing with as almost like chronic illnesses. A number of years ago, developed with a colleague, a psychology colleague, a clinic to diagnose and treat children with fetal alcohol spectrum disorders. And we're the only diagnostic center in all of upstate New York. And it's a really highly prevalent condition. And so my DNP project will be looking at ways to expand capacity across upstate New York for diagnosing children with FASD. Having my committee and having mentorship in the School of Nursing has allowed me to do this project in a much more structured and organized way to make sure that we evaluate outcomes so that we know that this is an effective intervention, and to really look at it from more of a scholarly perspective. I really think it will just allow me to maybe take my practice to another level, to look at problems, projects, opportunities in a different way, and be able to apply a new skill set to solve those problems. It's really exciting to see when kids have the supports in place that they need, how successful and happy they and their families can be. And so that really motivates me to be working on this project.